had a patient last week who came in and told me she was eliminating all these foods because of abdominal cramping and bloating. She was removing gluten and dairy and still didn't feel better, to the point where she was pretty much just eating rice, chicken, and a few bland vegetables, and still, again, wasn't feeling better. Turns out she had a bacterial infection in her gut, something called SIBO, small intestinal bacterial overgrowth. And the most frustrating part was she had been seeing a GI doc for years, and this doctor had no idea what SIBO was. So today we are going to break down exactly what SIBO is, where it comes from, and how to treat it, and give you a really high level overview. And make sure you watch our whole episode, because at the end we're going to answer a lot of viewer questions that we get from social media, from our own patients, all about gut health and some other fun topics as well. But first, Dr. Jen, we're going to talk a little bit about what we are seeing in clinic this week, what's coming up, patterns. Is there anything that comes to mind for you?
Yeah, I mean, this whole SIBO issue has been like top of mind, I think, especially lately. And we go through these phases with it. It is something that we see a lot, certainly. And in clinic right now, as you know, we're, participating in a clinical study to look at recurrence rates of SIBO. So we get these patients that have been treated for SIBO, whether they've been treated with natural therapeutics or antibiotics, and then it's coming back, right? So then you're doing rounds of what we call eradication, but sort of the landscape of how to manage SIBO is shifting into, okay, how do we fix the terrain? So I guess that's kind of where we are now in SIBO management is like, how can we keep these patients from continuing to be on this vicious cycle of feeling a lot better in a lot of circumstances, and then tanking again, right?
Yeah, and so these highs and lows, and we kind of want to find the middle ground there.
Yeah, and a lot of that does come down to, I think, for many patients, digestive secretions is like a lot of what I'm seeing with the patients that I've been seeing lately. And when we think about digestive secretions, then we're talking about, do they have enough stomach acid? These are some of the things we've talked about on the show, right? Do they have enough stomach acid? Are they hypochlorhydric?
Right.
Do they have, appropriate release of bile? So like their gallbladder secretions then, which affects how they, digest fat, and also affects the, it on its own, it has an antimicrobial effect in the bowel. Small bowel, and then digestive enzymes, pancreatic enzymes, a lot of those. And then, of course, motility issues too.
Yes, definitely.
Right? Yeah. But symptom-wise, I think, gosh, there's so many cases I can think of here.
We treat so much SIBO, right? And so, yeah, we have a lot to pull from, for sure.
Yeah. But if I think about like a case that stands out, like just today, I had a patient who was treated for SIBO a couple of years ago that I actually treated, and she had been doing fine. And then she moved overseas, and now, she's reconnecting with me because she's having GI issues again, and it's presenting a little bit differently now. And she's experiencing constipation. So she went to, the health system there, and they just put her on like an osmolytic, like basically like a Miralax, essentially. And she's, there's some improvement, but then sometimes now she's having like loose stools if she takes too much of it. So she's just like, okay, this is not treating the cause. And so she's back like, okay, what's even going on here? Because how did this all of a sudden, my bowel was like, it was fine. And now I've got these like pellety stools.
Yep. Totally. Yeah. And going back to what you said about the low stomach acid, this is something that I see a lot. So I primarily treat women, mostly women from, well, kind of a large range, right? Like, early 20s up through 60s, 70s, pretty much. But especially females in their 20s and 30s are so low in so many nutrients: iron, ferritin, B12, folate, vitamin D. And so when I'm seeing just across the board nutrient deficiencies. Of course, we're thinking diet, we're not getting enough nutrients in through diet, but I'm also like, are you just not absorbing these? Because a lot of patients who come to us actually have phenomenal diets, right? And because they love naturopathic medicine, they really want to be healthy, so they're kind of ahead of the curve there. And so that's awesome. And so I look at their diet, I'm like, oh, you're getting plenty of nutrients. What's going on? And it's like, oh, combine that with gut symptoms. You're not actually breaking your food down. You're not absorbing it. And low stomach acid is a main cause of SIBO. So I'll trial patients on hydrochloric acid, which is our stomach acid, over-the-counter supplement. And some patients can take so many capsules.
I know, isn't it insane?
It's crazy, right? And you really should only need 1 or 2 capsules of HCl before you start maybe burping or having, reflux, because that's a signal, okay, we've overdone it. This, we only need 1 cap or 2 caps. But some patients are like, oh, I can keep
they
going.
can take like 5, 6, 7. Which is just over the top. They don't even need that much.
Too much.
Yeah, it is. Like that is, I would say, it's almost like epidemic, right? That
truly.
You trial this in many of these patients and they're just like, don't get any heartburn symptoms at all. Now, obviously, for our viewers, this isn't something you should just go and start taking because there are contraindications for it. Like if someone actually has like more sort of like a gastritis, they have a history of ulcers. They're taking NSAIDs regularly. They could have some bleeding risk potentially. So we're careful about who we use this in. So this one specifically, you should really work with a functional medicine naturopathic doctor.
Definitely. But something to think about because that is also a cause of SIBO. The other thing I see a lot, both in combination with gut symptoms and without, is chronic fatigue or this like, I feel like I'm doing everything right and doing all the things, but I'm just so exhausted. That's something for me that's coming up a lot in clinic. And the gut is often somewhere where I will start with that, right? Especially if those, nutrients are low, we have those deficiencies plus gut symptoms. Of course, we're going to supplement to get those levels back up. But like you said, we got to go back to that gut terrain and make sure all of that is looking good. So, absolutely. Fatigue is definitely another strong symptom of SIBO. For sure.
And then the bloating, right? I think we get so many patients and they come in and some of them are confused. They're like, am I fat? Am I bloated? Like they don't even know what's even going on, right? And certainly, yes, like there could be something serious going on. So you really need like medical workup if you're having like ongoing bloating, because it could be ovarian cancer, at its worst. But like if it is diagnosed as more of a functional bloating, then that's a classic symptom of SIBO. And then we can breath test. So for people who aren't aware, to, diagnose this, it's an actual breath test. You're just drinking this solution and then you're blowing in tubes. You can do this at home or you can go to a designated GI office and have it collected. And, that a lot of times that's covered by insurance when it's done in a GI office, but it's not an expensive test, even if you collect it at home. And a lot of patients decide to do that because it's also convenient.
That's most of my patients opt for that.
And pretty simple, not really invasive procedure on like having to go in for scoping or something like that. And, it's pretty sensitive at picking it up. I mean, there's definitely false negatives with it, but you can, pick up a lot of cases. Don't you find that like, if you're testing for someone for SIBO, almost everyone is positive?
It's pretty much coming back positive, if not borderline.
Right. But you're suspecting SIBO.
Yes,
right?
Exactly. So we're good at detecting and asking the right questions. And I want to go back to what you said about the bloating. So ladies, hear us out. There is a difference between bloating related to SIBO and bloating because you have gained weight and have extra visceral fat. You guys are so funny. I literally would be super rich if I got $1 for every time a woman asked me, when I say, are you bloated? And they pinch their belly fat and they're like, look at all this.
Look at this.
And I'm like, no, because I see a lot of women for weight loss, right? So I'm like, no. I mean, like, do you feel like you could, stick a needle in your lower abdomen and like just deflate like a balloon?
Or
that's
like, or they're like getting distended after a meal. And some people are so like, it's not even food. Like I'll have patients coming in, they wake up and their belly is, you know, they could still be overweight, but their belly is a certain level when they wake up, or it could be flat. And then they start drinking water. This is when it's like at its worst. They drink water and they're like already looking, they're saying, okay, I look 6 months pregnant just drinking water. Because it's just like getting the digestive system going. And so it's sort of like waking up that bacteria, and then they start like producing gas. And then that's where that bloat comes from, is from the bacteria fermenting and producing gas. Right?
Exactly. So let's kind of dive in a little bit deeper here and do an overview of what SIBO actually is. So SIBO happens when you get certain types of bacteria in your small intestine, right? Not your large intestine. We have lots of bacteria in our large intestine. They do great things there. We really shouldn't have a lot in our small intestine, because that's for absorption of our food, right? Our stomach digests our food, gets absorbed in the small intestine. If we have a lot of bacteria there, they're going to interfere with absorption, which is why with SIBO, we see nutrient deficiencies, poor absorption. So we get this bacteria there, we eat certain foods, and the bacteria ferment that and make you feel bloated. So it's really common with SIBO, like you said, to have a flat stomach when you wake up, and then you just get progressively more bloated as the day goes on, because more liquids, more foods, right? Things like that.
Right. And then some people will notice that their bloat is really like they've been able to control it through certain foods. So they've gotten, I mean, some people are so in such rough shape that, like anything, as I said, they're drinking water and they're having a problem. But some people have gotten it figured out where they've gotten bait themselves. And when you learn what they're eating, like a lot of times it's like, I can eat chicken and a little bit of rice. And they're basically put themselves on a low FODMAP diet without even knowing about it. So that means that they don't have as much of that like fermentable carbohydrate portion that would come from plants. That would then like give the bacteria something to work on and produce gas. And that's really kind of key. And so those patients will come in, as you know, saying like, oh, I think I have food sensitivities, or I'm like allergic, I have food intolerances. But it can often, this is a case where this could be SIBO in many of these situations, right?
Yep, exactly. Patients will come to us on such limited diets, and they're like, I still don't feel my best. Like, I don't know what else I could possibly take away. And so we hear that term FODMAP a lot. It gets a little bit confusing. FODMAP is an acronym, and it stands for all these different sugars, essentially, in foods. Not necessarily bad foods. A lot of vegetables have FODMAPs in them, right? It's across the board. So this is not just a diet of, oh, I'm eating healthy foods or unhealthy foods, which makes it challenging. So, you know, a high FODMAP diet is going to cause a lot of bloating. So what we do is we'll put patients on low FODMAP diets. They're consuming less of these FODMAPs, and then that helps to quiet the bacteria down. But
it's not a treatment. It's not the problem, right? Like it's not going to fix, it's not doing anything. It's just a Band-Aid while you're actually dealing with, okay, we've got to get these counts down. It's just, you're giving them less fuel, basically. So you're not giving them food. You're starving them a little bit, but they're there. And so as soon as you dump some of those FODMAP foods in there, then off they go.
Off they go, and you're bloated again. And so a lot of times we'll use the low FODMAP diet to help us diagnose if for some reason a patient doesn't want to or can't do SIBO testing. We'll say, okay, let's try the low FODMAP diet, see how you feel. Or if a patient is just, you know, so bloated, so overwhelmed with symptoms, we'll be like, all right, do this.
While we're treating them. Exactly. So as they're getting better, then they're going to be able to like reintroduce those foods. But on its own, like long term, it's not a good solution. So this is where, you know, if people are been treated for SIBO and they're still on a limited low FODMAP diet and they can't really kind of sway from that at all and without getting bloated, that means that the treatment is not effective yet, right? So that's another sort of like, it's almost diagnostic, like, okay, the SIBO hasn't really cleared. And this might be more of an issue with like what we're talking about with terrain. So like, yes, you can use antibiotics, you can use, herbal approaches, you can use an elemental diet to sort of get those counts down. But in the big picture, what we're talking about with recurrence and the terrain is then thinking about the digestive secretions and being able to support those long term, right?
Exactly.
So a lot of these patients might need to be on some hydrochloric acid support, or they need to be on digestive enzymes or something like that longer term.
Yep, totally. All right. What are a couple of top reasons that come to mind for you as to why we get SIBO in the first place?
Yeah, so I would say a lot of it is like from what I'm seeing lately, big categories would be medication induced.
Yes.
Huge. So people that have been taking antacids, these proton pump inhibitors, things like omeprazole, the Nexium, but even the H2 blocker class, like where people are like, oh, I got off the PPI and now I'm like taking Pepsid. You know, okay, there's an argument maybe that's a little bit better, but it still is not good for SIBO.
Right, exactly.
So, because it's lowering your stomach acid levels, and so you're still potentially dealing with issues with your bacterial balance there. So I'd say that's like big on this list. Then the next thing I think is actually these like digestive secretions, I think. And I think like lack of it. So just inherently. So not that it's necessarily medication induced, that people are really, why are they reduced? Because they're probably stressed, major cause of it, as, you know, adrenal dysfunction, reducing your ability to make stomach acid, digestive secretions. Another part of it then is like just our environment really, you know, wreaking havoc in the entire digestive system. I think that's a piece of it.
Agreed. Which a little bit of leaky gut, which we're going to talk about in our next episode. Other things that I really see, anxiety. 1000% anxiety. And I would say my hardest cases of SIBO to treat are my patients who have some tough anxiety. And I feel for them because that is really tricky.
And it's like, that's actually been clinically studied because, you know, for anyone who's not aware, I present on SIBO a lot to other healthcare providers.
Yeah, Jen's kind of a big deal, you guys, in the SIBO world. No, but really she is.
So we do know a lot about SIBO, and there's a lot of research on this, right? But people who have anxiety and also even personality traits, so people who are introverted have higher rates of SIBO.
What?
Isn't that wild?
Oh my gosh.
Yeah, so it does. So like anxiety is going to affect those digestive secretions, and then it can also affect that nervous system in the bowel. So we haven't even really gotten into that, but that's another big cause. That I think you mentioned earlier about like motility a little bit, but that's another reason, you know, we think about the anxiety, nervous system. We've got our own sort of like gut brain, right? We got our own nervous system in the gut, and then that's affecting the ability to sort of have this like sweeping mechanism that cleans the bowel.
Yep, exactly. All right. We want to get to listener questions. So just quickly, let's do a really brief overview. And we've talked about it already, but treatments for SIBO. So antibiotics are one option. We're not a huge fan, of course. No surprise to anyone.
And so just like for context, in the past, I was sort of, okay, like here are your options. Antibiotics, because there's, you know, it has been shown to be effective
for SIBO all the time.
Herbal antibiotics and then elemental diet. But now, since again, like looking at the research on this, there was a study that showed that people that took one of the main classes of antibiotics that's used for SIBO had higher rates of systemic candidiasis. Now, this was for a separate thing. This was inpatient transplant patients in the hospital, but they ended up, this group that was taking that antibiotic had higher rates of fungal infections in their blood. So now I'm kind of like, I'm not loving that. And so my concern with the antibiotic is, are we creating an intestinal environment that maybe could make fungal elements overgrow in the bowel, right?
Exactly.
So now I'm more inclined to say, you know, I would recommend herbs or an elemental diet. If you want to do antibiotics, like here's why I probably wouldn't do it. But if you want to go that path, I'll support you. But we're going to work on all these other things too, right?
Exactly. Yeah. Same thing with me. All right, beautiful. Let's get into some questions that we gathered from our social media and then from patients in clinic. All right. If we have SIBO, can we still take probiotics? Can we take any probiotic? Should I just get a generic over-the-counter huge probiotic with a bunch of stuff in it? Like, what should I do with probiotics and SIBO?
Yeah. So, and this varies from patient to patient, but what I tend to do when we're in that initial phase where we're trying to figure things out and we're trying to get those counts down is usually the only probiotic I'll recommend is actually a yeast, Saccharomyces boulardii, that has the ability to sort of disrupt the biofilm that can build in there. So it does have that benefit, and it does have its own sort of biological balancing effect on the bacteria. So it's not like a native bacteria, but I know, you know, it shouldn't cause any additional digestive distress. Right?
It's so true.
But once you start adding the just like general bacterial support, some people feel better on it, but some people feel a lot worse.
It's so true. And it's really tricky. So when I have a patient who comes in with SIBO, I actually take them off their probiotics because they're always on a bunch. I do, you know, usually those antimicrobial herbs that we talked about without probiotics, sometimes in conjunction with Saccharomyces boulardii. But then once we're done with that phase, then I start to do probiotics. I do the Saccharomyces if I haven't already. But then it gets really tricky, right? And this is where microbiome testing can be helpful of like, all right, what are we actually low in? What are we too high in? Because I have absolutely given patients these broad spectrum probiotics after an antimicrobial treatment, and they actually don't feel better. They feel worse. And that just stinks. So
I know.
It's tricky, but I always take patients off of them because I'm like, no, this is not helpful. We have love-hate relationships with probiotics.
I know. But yes, like each person is gonna, you know, we personalize for sure, but we do have some sort of, you know, guidelines to think about in terms of what stage they're in, for sure.
Another good question that comes up often is, can I stay on my herbal antimicrobials long term? Because patients often feel really good on these because they're great at eliminating the bacteria that cause the SIBO. So they're like, oh, my bloating is gone. Can I just stay on these? What's your take on that?
I don't love that because it's still telling me, okay, there's something going on. What's going on within this intestinal environment that we can't keep these bacteria in check? Like, have we still not addressed motility? So that just tells me diagnostic wise, like, okay, we haven't really like affected the root cause, because you shouldn't need to be on these forever, right? Like we shouldn't be taking antibiotics forever.
No,
right?
definitely not.
If you're on a long-term antibiotic and can't get off of it, there's something
it's not good
going on that we need to figure out.
And you know, the herbal antimicrobials that we use are strong, you know, they are strong. And that's why they work so well. But yeah, I agree with you. We just can't be on these long term. And it usually means, okay, we're missing something. We're missing that root cause as to why this SIBO is continuing to fester.
So we can pulse them. So there's kind of like a middle ground sometimes for these patients where we're pulsing them while we're trying to figure out that root cause. But or
you can be like me and know that stress and anxiety are a main cause of your SIBO.
Like,
and
what are we ever going to do about that?
I'm like, well, you know, this season of life, we'll just keep pulsing.
On and off.
Another question we get all the time is, can I take a fiber supplement when I have SIBO? And I'm, you know, I'll start this one because you've been under fire here. It depends. And you know, you guys are going to get annoyed with us with these listener questions because it depends, maybe. Right? But that's because we're good doctors. So with fiber, yes, you know, if you have SIBO and constipation, it's really common for a patient to be on fiber because they're trying to move their bowels. But fiber can be incredibly bloating and contribute to that bloating, that abdominal discomfort when you have SIBO. With the exception of a really specific type of fiber called partially hydrolyzed gum.
Which is that's a mouthful.
It's a mouthful. It's a whole other conversation. But I think the takeaway here is you can use a specific type of fiber, and there's also been some research that shows that when you add that into certain SIBO treatments, those treatments can be more effective, which is awesome.
Right, in the initial phases, and then also for recurrence too. So that PHGG often is a good addition as you're sort of moving into these sort of like maintenance phases, trying to prevent recurrence. And then you can sort of, especially if someone is more of a constipation prone, you can actually, go a little higher, titrate the dose up to make sure you're dealing with that constipation with that specific fiber.
Yeah, exactly.
Yeah, so that's our go-to one.
Yeah, totally. But for the most part, I'll take patients off of their fiber because it's probably just contributing to that
right,
bloating.
because it's a lot of fiber products are going to be like a mix of soluble and insoluble, and there's a time and place for that. And maybe, and some SIBO patients can, they're like,
tolerate
we've
it.
Figured everything out, they've got them in a really good place, and then they can go in that direction. But that early stage, definitely, we're going PHGG there.
Yep, really tricky.
Yeah.
All right. What do you think? I think that's good.
I think we did a good job. So, like, for viewers out there, if you want to have your questions answered,
yes, comment on all of our YouTube channels.
Yes, because we're just collecting these now, and we're gonna incorporate that into the show. So,
exactly.
Our next show, we're gonna have more viewer questions.
Yeah, awesome, great. So thank you for joining us. I didn't say at the top of the episode, we are the Natural Doctors. I'm Dr. Katie Danello. This is Dr. Jennifer Stagg. Thank you so much for joining us, and make sure subscribe to our YouTube channel so you never miss an episode. We've got some really great topics coming out. Thanks for joining.